Hi to all of my viewers here. We have a very special guest with us today, and he is none other than Dr. Sita Ram. So, he's an orthopedic surgeon and also the MD of Amulya Hospital. And apart from his profession, I really admire his values as a person. So, that is what makes him special. And I'm really honored to have you here, sir, today with us. And in the course of time, Dr. Ram would share as to what are the myths around knee pain, back pain, and anything and everything to do with ortho care. So, welcome, Dr. Ram, to our show. And I would like Dr. Ram to speak about what are the myths around knee pain, back pain, and anything to do with ortho.
Thank you for having me. So, whenever somebody is diagnosed with an osteoarthritis, let us say that somebody visits a doctor with knee pain, and he or she will be told by the doctor, look, you are having osteoarthritis of the knee. Then, most people they get worried. They feel that something very bad has happened to my knee. Oh, whether I'll be able to walk or not, whether I'll be able to get my children married or not. They'll have all sorts of worries. They think that they'll be bedridden, they may become bedridden, they may become, they may be need for surgery, they feel like that. But actually, there is nothing to be worried. Osteoarthritis is just like, it's not a disease actually, it's not a dreaded disease.
Right.
It's an age related wear and tear
Okay.
in a normal words, if you want me to put it. In technical terms, we call it a degenerative condition,
Right.
which translates loosely to normal age-related wear and tear. Just like your hair will gray with age, your skin will become wrinkles will happen in the skin, and there will be some changes in
In the
all the
body.
organs in the body. See, you cannot expect anybody like to be in their 20s into their 50s. There will be
Yes.
changes in the face. In the same
Yes.
way, just like the external appearance changes with age, the cartilage inside the knee will show some changes. And because the cartilage loses the ability to regenerate itself
Right.
as fast as it would in
Yes.
an younger people,
Yes.
there will be some episodes of pain.
Got it.
So that is called osteoarthritis. It is
Okay.
a age-related degenerative condition.
Right.
Having said that, it's not true to say that everybody with osteoarthritis will end up in a wheelchair or can't walk or can't do their normal activities.
Right.
A good number of people with osteoarthritis will be able to do all their work
Right.
with proper exercises, proper guidance on how to keep their muscles in a good position.
Right.
And at times they may require medicines. Medicines are temporary.
Okay.
With temporary support with medicines and exercises, they'll be able to get back to their normal work,
Right.
and most of them will be doing very well.
Okay.
And some patients in whom surgery is necessary, there are good surgical options nowadays,
Got it.
and we make sure that they walk and enjoy their life uh, into their 70s and 80s as well.
Correct. So, like as you had mentioned, about osteoarthritis. So, the usual scenario in people's mind is that it is a dreaded disease. It is something that will land up in something that is major and would require a lot of doctor intervention. And it is, as you rightly pointed out, not as a dreaded disease, but it is more like a degenerative thing that happens as per age. So, having said this, do you think that exercise, people with osteoarthritis, do you think exercise for them is bad?
Yeah, this is one common myth people have.
Okay.
People think that once you have knee pain, you should not sit on the floor, you
Yeah.
should not use Indian toilets, you should not do regular stair climbing, you
Correct.
should not do walks
Correct.
and all. But that is a myth.
Okay.
In some people where the pain is more,
Hmm.
like for a couple of weeks, they may need rest. When the
Okay.
knee is swollen,
Okay.
when it is too much pain, they may
Okay.
need to take rest.
Okay.
But it's not good to
Okay.
take rest for prolonged periods.
Okay.
See, imagine any mechanical or any, imagine like a bicycle or a two wheeler. If you keep it without using, if you get a new bike,
Hmm.
keep it there,
Hmm.
what will happen? It will not
Right.
start.
Right.
If you don't use it, it will become stiff. In the same way, people who are doing gentle, regular exercises like walking, like stairs, like moving the knee regularly,
Yeah.
they will have more pain free years to their
Got it.
life
Got it.
compared to people who don't exercise,
Hmm.
who just limit their lives
Hmm.
to a couch.
Hmm.
They have more pain.
Okay.
Why?
Hmm.
Because the cartilage is
Hmm.
designed
Hmm.
in such a way that as we move
Hmm.
the joint surface will be reforming every day.
Okay.
That's a natural process.
Got it.
See, no mechanical joint lives for 70 years or 80 years without any maintenance.
Correct.
Can you imagine a person's knee moving for 70 years?
Right.
This fan, this no mechanical device lasts for 70 years.
Absolutely.
But the human joints last.
Last.
The secret, they are getting replaced, they are getting rejuvenated every day.
Right.
Every day, the cells of the cartilage will go away. Some cells which are damaged will go away. New cells will form.
Right.
But the point is, they form. They take little time as we age.
Got it.
In an younger person, if there is a cartilage, some cells are lost. They form very soon.
Soon.
In an older person, they take little long. But for the cartilage to reform, you need what is known as synovial fluid.
Okay.
So whenever a joint is moved,
Uh-huh.
the synovial fluid is spread across all the surface,
Okay.
and from the synovial fluid, the cartilage gets its nourishment. The
Okay.
cartilage is rejuvenated.
Got
Number
it.
one. Number two, whenever the joint is moved, the muscles are stretched to the maximum. The muscles will become stronger. They don't become stiff.
Okay.
The joint capsule and other soft tissues, they won't get stiff.
Okay.
The bones in a person who is walking regularly, they maintain strong.
Okay.
So in essence, exercise is good
Right.
because it helps to keep the bones stronger,
Correct.
muscles stronger. It keeps the joint, soft tissues supple so that it is moved every day
Right.
easily. And it also ensures that the cartilage is regenerated regularly. So
Got
exercise
it.
does help.
Got
But
it.
for a short period of time, when the pain is more, you may have to take rest
Right.
along with some pain medicines.
Right, right, got it. So this is what makes us understand that the movement of the joints is important. Be it whatever age, but I think that only helps us
Yes,
to regenerate
movement is essential
movement is
for a
essential.
healthy joint.
Got it, got it. So people with osteoarthritis usually have this in mind that a surgery is required, or there is something called the knee replacement surgery that is essential. So what is your view on this?
Yeah, knee replacement surgery is a great surgery. It has changed the lives of uh, lakhs, millions of people. But it's not to say that everybody with knee pain will require a surgery. Nowadays, people are thinking that I got knee pain. No, let me get my knee replaced. No, it's not like that. It is knee replacement surgery is useful for people in whom other methods
Okay.
of pain relief are not giving
Okay.
results and in whom they are having pain despite other methods. What are the other methods? We give medications to reduce the pain and swelling
Okay.
for a short time.
Okay.
Then we do give medications to improve the status of the cartilage.
Okay.
The nourishment of the cartilage is improved by many medicines.
Okay.
And more importantly, we do teach them certain exercises to
Okay.
keep the joint supple, mobile, and strong. So
Okay.
that with each step they take,
Yes.
the loads are transmitted properly and the cartilage is not subjected to uneven loading,
Okay.
and it will have time to regenerate. So,
Got it.
exercises do help. Apart from this, some lifestyle modifications
Okay.
like maintaining a proper weight
Mm-hmm.
also does help in people having a pain
Yes.
free knee joint for a long time.
Got it. Got it.
People also should not be afraid of the spikes of increase in pain.
Okay.
See, knee osteoarthritis is a degenerative condition. Like I said, the degeneration will increase with age
Okay.
slowly.
Okay.
Whereas the pain,
Huh.
it comes and goes, comes and goes.
Got it.
So what I have noticed is many people, when the pain is more severe,
Mm-hmm.
they think that, oh, my knee, something has happened, let me get this operated. You
Yes.
should not be in a haste,
Hurry. Yeah.
because whatever said and done, the joint which we all have, the original knee joint, is original.
Right.
By replacement, we are replacing the original joint with a man-made joint.
Yes.
A man-made joint will work well when the
Yes.
original is working very less.
Yes. Yes.
So it may not be useful in younger patients who is having occasional knee pain. You should not go for surgery.
Got it, got it. So now that you've shared about what is osteoarthritis and some myths around, the knee pains which is very frequently seen among people, and nowadays I think even the younger generation, a lot of patients coming to you for this kind of problems. But before we move forward, I would love to tell my audience a little bit more about Dr. Ram. So I would like to mention that Dr. Ram, apart from being an orthopedic surgeon, he has a lot of other awards and medals that he has won for his amazing work. So I would like to mention that Dr. Ram has completed his DNB Ortho in 2003. He also has an experience of 4 years as an assistant professor in CMC Vellore. He has done his 1 year fellowship in the USA. He holds Dr. M. Natarajan Gold Medal in TNOA and Dr. Vyagarasa Varudu Gold Medal in the AP State. So this is a little bit that what I can tell about you. I'm sure there are a lot of other credits and a lot of other feathers to your cap, but then yeah, as we progress, I would love to speak about it. So now that I spoke a little bit about your journey, can you just tell me what inspired you to become a doctor?
There is nothing special, but I was always inspired by the chance it gives us to help fellow human beings.
Right.
So be in connect with people,
Right.
touching the lives of people every day, and it's from my childhood I wanted to be of direct help to the people.
Got
I'm
it.
sure many other professions do give you a chance to serve people,
Right.
but in my profession I take the pride of helping them directly.
Absolutely, absolutely. So that's a very nice point that you have mentioned. So now moving forward, now that you spoke and focused on the knee pain and osteoarthritis, I would also like to know that there are a lot of myths around back pains as well. So and especially women in the ages of 30 to 50, I often see them complaining about back pains. So what are your views on it, and how can these myths be busted?
Yeah, we do see a lot of people with back pain,
Yeah,
and like you said, mostly women.
yeah,
Most women feel that the back pain is related to their pregnancy
yeah,
or to that particular injection which was given during their C-section,
yeah,
and they will attribute to many things, which
yeah.
is actually not true.
Okay.
Um, See, back pain is very common.
Hmm.
If you see, there will not be any one person without back pain at some point of his or her life.
Yes.
That is because each time we sit or stand, the muscles in the back are working.
Correct.
Only when you lie down, the muscles will take some
Rest.
rest.
Hmm.
So the back muscles, the muscles which support our back and to help us make sit straight,
Hmm.
they are working all the time.
Correct.
And in our daily activities, when we bend forward or when we stretch some backward, there will be some strain in some of the muscles,
Correct.
and that leads to back pain.
Back
One common myth people think is that any injection in the back is bad, it will lead to
pain.
back pain.
Hmm.
Because back pain is so common,
You're right.
and we always want to attribute it to something or the other, they do it, but it's not true. The other myth about back pain is many people think that you should not bend forward, you should not do this, you should not do that, you should not do any work and all. But that is a myth, because when the pain is severe, I agree that you need to take some rest until the pain subsides, along with
Yes.
some pain medicines.
Yes.
But once the pain decreases,
Mm-hmm.
it is advised that you do regular exercises
Okay.
to strengthen your back,
Okay.
like little bit of yoga, bending forward, bending backwards,
Okay.
like Surya Namaskar. All
Yeah.
those things involve bending forward as well as bending backward. They are
Right.
stretching the back muscles, they're also
Right.
strengthening the back muscles. muscles.
Right.
They do help. And regular walking, regular
Correct.
activity.
Correct.
The other thing nowadays, what we are seeing mostly regarding the back and neck is people who are working with computers
Yeah.
most of the time because
Yeah.
they sit all the time.
Yeah.
So, what I suggest them is to have a proper ergonomic chair so
Okay.
that there is some proper support.
Okay.
They should have their system at a proper height
Okay.
so that they are not like leaning forward or backwards. Then they should have some support for their hands.
Okay.
And I suggest them that they change the position
Okay.
of the chair little
Okay.
bit to one side or the other side
Okay.
often.
Okay.
What happens when you shift to a right or to the left? One set of muscles will relax, the
The
other
other
set of
set.
muscles will take over.
Right.
So every couple of minutes they can do it. Every couple of hours they can get up from the chair, take a walk, stretch a little bit and come back.
Correct.
Every couple of minutes they can turn their head to sideways and do some stretching of the neck without getting up.
Mm-hmm.
So these tricks they go a long way
Got it.
in making their suffering lesser and lesser.
Got it. So, Dr. Ram, one thing that I had in mind was people are usually a little worried when they get their MRIs done and then when they receive their MRI reports. And I have seen people in families who, they really get worried by seeing the reports. So, what is your say on this?
Yeah, now that with the advent of MRI, which is available so much very well within the reach of all of us, it's a great tool that MRI allows us to literally look at each and every organ inside without touching. But the problem is many times people come to me with an MRI and they have already seen the report and they have googled each and every sentence in it,
Okay.
and that's a big problem
Right.
because let me tell you, after 40
Hmm.
there is nothing like a normal MRI for a back.
Okay.
So anybody who is 40 years of age, if you take an MRI of the back, it is not going to be normal. There
Right.
will be some changes.
Absolutely.
It's like if I take a picture of a 40-year-old man and send it for reporting, what will the report be? The hair is thin by a so and so percentage, the density of the hair is reduced, then there is some, say, 10% of graying,
Yeah.
then there is 20% of wrinkling.
Yeah.
Do you worry about all these things?
No.
These are age related changes.
Yes.
In the same way, if you take an MRI, there will be some disc bulge, some nerve impingement. These are terms which you don't have full knowledge about. And then you start worrying. Then you will type disc bulge in the internet. Then you will start, the internet will be filled with options.
Yes.
And generally, the options are more catastrophic.
Yes.
Surgery, injection, sciatica, everything will pop up. And then you will be worried.
Correct.
So my advice is stop worrying about the MRI report. Let the doctor see the MRI report. Let him interpret. Let him tell you what is good, what is needed for you,
Yes.
and not you seeing the MRI. And one more thing which I want to tell you regarding MRI is nowadays people started getting an MRI by themselves,
Okay.
which is a bad thing because they don't know which part to get an MRI for.
Correct.
And there is also this myth that MRI scan will tell you anything anywhere in the body. It's not so.
Correct.
So many times, often I see patients who have actually a hip problem get a MRI of the spine
Oh.
or vice versa.
Okay.
And it's going to be a problem because you have a problem in your hip, you got an MRI of your spine
Fine.
because you don't know which MRI to get.
Correct.
So
Correct.
first go to a doctor, let the doctor examine you, listen to you, and then he or she will tell you what MRI is required or not.
Correct.
So there is this fancy of getting MRIs, getting tests done before you see a doctor. So the general idea is to go to a doctor first with your problem, let the doctor decide what tests you need, and then get them done. That is a better way.
So, thanks for sharing these tips with us, sir. And you have been in this profession for like 2 decades. So, I would like to ask you if you have been in this profession for like 2 decades, and I would like to ask you if there is any case, one case which you can share with us briefly as to how the patient had come to you, with severe symptoms and pains, and then how the treatment helped him to again build a better life.
Yeah, we often see patients who are suffering from years from
Yes.
backache,
Yeah.
because I regularly see patients who come to me, sir, I'm having back pain from last 10 years.
Yeah.
I took 5 MRIs.
Yeah.
Everybody says there is
It's
nothing.
nothing.
Everybody gives medicines, but
Yeah.
then I am not.
Yeah.
Then I patiently examine him and I will tell them
Yeah.
that you don't have a disease. That
Okay.
is the problem. The problem is that he doesn't have a disease,
Yeah.
but he has suffering.
Okay.
The reason is because of the pain, he stopped using his back. He became very
Okay.
stiff,
Okay.
very careful.
Okay.
So, like this, he's moving.
Okay.
So, he's not exercising it. So, I talk to them, I put them on some pain medicines for a short duration,
Okay.
then make them do the exercises
Okay.
and regularly increase the uh, stretching and strength of the muscles.
Got it.
A good number of them,
Okay.
I would say 99% of them,
Okay.
these back pains without any major disease, they do very well
Okay.
with exercises
Got
and
it.
reassurance.
Understood. Understood. So I think you have touched almost all the points with regard to back pain and the knee pain, and how many myths that I myself had so many myths, and I feel so happy that all those myths are now cleared. And now that we're almost coming to the end of the interview, I would like to ask you that with regard to overall health, and with regard to our bones and joints, what is the message that you would like to give our audience, and also to spread some positivity of around people? What is it that you would like to share?
Um, See, do not catastrophize your disease. Many people think that whenever there is an osteoarthritis or sciatica is, whenever some disease is labeled, they feel that it is a catastrophic happening. Do not
Yes.
catastrophize. The new modern medicine has come. We make sure that you walk without pain and you enjoy your life to the maximum extent possible. A good number of times, it's not the disease that is cause of the suffering, it's the fear of the disease that's cause of the suffering. So
Right.
don't be feeling devastated by the diagnosis,
Right.
number one. Number two, do not do a lot of googling. See, it's good to know about your disease, but the moment you type back pain,
Yeah.
Google will give you, internet will give you all sorts of weird things,
Yes.
because you don't know what to search.
Yes.
Back pain is common in normal back sprain or catch also can cause back pain. Cancer also can cause
Cause
back
back
pain.
pain.
But as a layperson, your attention will be drawn towards diseases like TB, cancer, and all
Yes.
sorts of things.
Yes.
So do not Google. Go to your doctor, take help,
Yes.
let the diagnosis be made,
Yes.
and then you can be better.
Correct.
The other thing is maintain a proper balanced diet and weight, and do some exercise regularly,
Okay.
because exercise is good for the joints.
Yes.
Exercise will help you in keeping the joints and the back in a
Right.
good state so that you will not have pain.
Right. So, can you just a little bit expand on the last part that you said, that is on the food, that a balanced diet that people can have, and also on how much exercise and what kind of exercise is needed for a good healthy lifestyle?
Food, it's any balanced diet is good. There is nothing like special diet for the back or the special diet for the knee. A balanced diet. But in our society, we all tend to eat more of carbs.
Yes.
So it's a good idea to reduce the amount of carbs so that
Okay.
you won't have diabetes
Right.
or high cholesterol levels.
Right.
So reduce the carbs and fats,
Right.
increase the vegetables, increase the fiber in your diet.
Got it.
That will help you.
Mhm.
And coming to exercise, regular walks, at least half an hour to 45 minutes a day, regular stretchings, and all should help. Try to avoid the stairs, try to avoid taking the lift, and encourage stair climbing for a couple of steps, because without your knowledge, you will be spending more energy in your daily activities.
Yes.
If you just do that small, using the stairs,
Yeah.
taking the um,
Walk.
walk,
Yeah.
and all those things will help you.
Got it. Yeah. So this brings me to the end of interview. So thank you so much for being with us today. It was really very amazing to listen to so many amazing insights, and I'm sure our audience out there would also love to get to know so interesting insights. And I'm sure this is going to be useful. Thank you once again for joining us today and sharing your expertise with us. And we look forward to all our audience joining us for such shows. So for such more information, please like, comment, and subscribe us. Thank you.